And this is going to be an exercise just for her glutes, which is her bum, and her hamstrings. Now that she's in this on all fours position, even though she's only in her first trimester and she's not showing, right away let's practice proper posture in this position. If you would imagine if she had her belly down here, if she was 7 or 8 months pregnant, that is a lot of pressure on her spine, and her spine has to hold that, okay? So she's working against gravity. So whenever you're on all fours, I don't care what you're doing, even if you're crawling around on the floor chasing after a toddler, tuck your belly button in. That'll take a lot of pressure off the back, and it won't arch, and your back won't be strained. And then by doing that, you're actually engaging your deep transverse abdominis, which is part of your core muscle, which is always a good thing too, okay? So being in this nice flat position, she's gonna extend one leg back, nice and straight, her foot is flexed. Okay, you're gonna drop it to the floor first, okay? And then she's gonna lift up without rotating her spine, and then come down and don't touch the floor. Yeah, and then up, and down, up, and down. Okay, then one more up, and she's gonna keep it up, and now she's gonna bend and extend at the knee. So bend your knee, keeping your knee up, yep, and then straighten, bend again, straighten. This is so 20-minute workout, for sure. Does anybody remember 20-minute workout? And then last one, she's gonna bend her leg, and now she's gonna press the sole of her foot right up into the ceiling. Up and down. Yep, up and down. Good, and she's really working those glutes, doing this small exercise. And then relax. Now you can relax. And now sitting on her bum, to stretch after this, and this is actually a great stretch for sciatica. You're going to sit in a V-sit position. And crossing one leg over the other, pulling her foot in. You get a nice stretch in your hamstrings and right across the glutes. And this is very good if anybody is suffering from sciatica. This is a really good stretch for that as well. Okay, so now I'm just going to talk a little bit about core. Yes, now that you're pregnant, it is absolutely safe to do abdominal exercises. Please do abdominal exercises. You're going to need it to push that baby out, for sure. Okay? Probably the best abdominal exercises, though, I would say would be the transverse. Your core muscles are pretty much 3 fundamental areas. Your transverse, which is your deep abdominal muscle, your multifidus, which are deep spinal muscles, and your pelvic floor. These are the areas that get strained the most as your baby grows bigger and bigger. So engaging these areas and strengthening them will definitely help you carry your baby a lot better without any difficulty or pain. So I'm going to have her lie on her back. Now, if anybody have heard it, you can't lie supine when you're pregnant. You can't lie flat on your back. Well, that's yes and no. You're safe to do it up to 16 weeks gestation, but after that, any exercises you can do flat on your back, you just want to adjust it to an inclined position. So just think about keeping your heart above your baby, okay? So, but now that she's in the first trimester, she's still okay to be flat on her back. So hands behind her head. She's just going to do a simple crunch. So by tilting her tailbone just a little bit forward.
Please go to the station right now and meet Cookie Monster and Elmo.
Okay.
Stage Cookie Monster and Elmo at 3 o'clock. 2D and B.
And engaging her abdominals, she's going to lift her shoulder blades up and then come down. And up and down. Now there is a condition that about 50% of pregnant women do suffer from called diastasis recti. And that is when the rectus abdominis, which is your outer layer of abdominal muscle, actually separates. And if it separates more than 2 finger widths, you can continue to do crunches, but you just take your hands across your midsection, encouraging your rectus to stay together, and then proceed and do a crunch. Okay? Or you could take a towel. You could take a towel and encourage them together, and then still do your abdominal crunch. But again, the best thing to do is work your transverse, which is an isometric exercise. So I'm going to have her flip over and show you a plank. Planks are wonderful, but again, they're right up there with squats and lunges. People hate them, but they're very effective. Okay, so she's just going to be on her elbows. Her elbows are pretty much placed right under her shoulders. And then she's going to scoot her knees back, and she's going to stop when her spine is parallel to the floor. So keep scooting back, 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 drop your hips. There you go. And she's pulling her belly button right into her spine. She is activating her transverse abdominis big time. Now she could, if she was really in excellent condition, okay, I'm not saying that she's not in good condition, but if she was used to it, you could actually do it on your toes, okay? But she doesn't plank exactly, there you go. But then you're just doubling up, okay? So right here, just knees to spine, and that, again, that's an isometric exercise. But when people do isometric exercises, there's a tendency to hold your breath. That's a big no-no in pregnancy. And it has nothing to do with your baby, quite honestly. Your baby's getting all the oxygen it needs. It's you who's going to fall on your face if you pass out. And that's no good. Okay? All right. So now, you can relax there.
Okay, so let's...
Right up there with the plank and the squat, we're going to do a push-up. Push-ups, we love push-ups. And the reason we love push-ups is because they're excellent for your upper body. They work not only your chest, but your arms and your shoulders. They're wonderful. So it's another threefer. So we want to place her hands just under her shoulders. Okay, so bring them a little bit. There you go. And she's pulling her belly button into her spine again, because remember, her abs are working against gravity, right? We want to support the back. She's going to do an inhale, bringing her chest towards the floor. So not your head and not your neck. You're tucking your neck in. So you're going to bring your chest in towards the floor, and a big exhale and push up. Because remember, you want to exhale on exertion. Again, so inhale on the way down, exhale, push up. One more, inhale, exhale, and push up. Okay, and then you would sit back, get a nice stretch in there, open up the chest, open the lats. Okay, this is an excellent exercise for your upper body, and you're going to need your upper body when you're carrying the baby around in the car seat. Absolutely. Okay, now, remember I was talking about that hormone called relaxin? Okay, some people also suffer from carpal tunnel. She's fortunately doesn't have that, but if it was too much pressure on her wrists, I would do a modified push-up maybe against the wall, or not even do push-ups at all. There's all kinds of other chest exercises you can do, but push-ups are really the ideal. So I'm going to keep her on the floor on all fours, and now we're going to do something for the low back. Okay, she's going to extend the back left leg parallel to the floor, flexing her foot, and then extend the right arm out, and without rotating her spine. So this is very yoga, okay? But she's totally strengthening her back right now. Remember the three key factors of core: your transverse, your multifidus, and your pelvic floor. Who's Kegeling? Everybody is now that I just said it, aren't you? Okay? Kegel. You need to Kegel. Everybody Kegel. Kegel now. If you don't know what a Kegel is, just imagine you're holding a $100 bill there, and you don't want to lose it. Okay? Hold it for about 5 or 10 seconds. You don't want it to drop. Okay? And then she's going to switch. Nice and balanced. Great. And parallel. And of course, her belly button is tucked in. Great. And you can relax. And then, on all fours, we're going to do a cat stretch now, just stretching out that lower back. So right under, tucking that sit bone right back. And again, in pregnancy, because we've got all this weight now, you're not going to go back to a normal cat stretch where you would go back into the arch. You're just going to go back to a neutral spine. Okay? Supporting the back. And again, right under, stretching the lower back. And then back to a flat back. Okay, and one more. Up and back. So those are just a few exercises that you can do on your own, at home, okay? And remember I'm just going to leave you with a couple of things to remember. Proper posture. As soon as you find out that you're pregnant, if you've always had lousy posture, now is the time to get in the habit of good posture. Stick the chest out, keep the shoulders back, tuck the tailbone under. All of a sudden now you've aligned everything and you've totally taken the pressure off. So good posture. And again, strengthen your core. You're going to need your core when you're pushing that baby out. Okay? So again, I'm at Core Expectations, booth 402. If you have any questions, please feel free to come and talk to us. We have some great trade show specials, as well as anything else that you need. Thank you very much.